Hello, my name is Camilo Ongarra and I'm going to talk about amaurosis fugax caused by a branch retinal artery embolus. So, this is a condition in which a person loses the vision in one or both eyes. This can be total or partial. It usually lasts just few seconds or minutes, then it returns to normal. Occasionally, it may last for several hours, and this is caused by interruption of blood flow to artery that supplies blood to the retina. So, what are the causes? Uh, the reason of this problem can be buildup of cholesterol and fats. There is a plaque in the arteries near the eye or a clot. This clot can flow to the artery that supplies blood to the retina, blocking the flow of blood to the retina. When that happens, vision is lost for as long as the blood flow is interrupted. The risk factors are alcoholism, smoking, high cholesterol, high blood pressure, diabetes, cocaine use, and fast food. The symptoms uh, is painless and sudden loss of vision in one eye. Visual loss is often from the top down, appearing like a curtain being pulled down over the field of vision. A rapid return of vision. Vision generally comes back in a few minutes to several hours. Applications in medicine. Typically, patients describe this diminished or absent vision in one eye that progresses over a few seconds and lasts for seconds to a few minutes. The impairment progressively may involve the entire visual field. The loss of vision usually begins in the upper field, less frequently in the periphery, and rarely in the lower field.
Amaurosis, Greek meaning darkening, dark, or obscure, is vision loss or weakness that occurs without an apparent lesion affecting the eye. It may result from either a medical condition or from excess acceleration, as in flight. The term is the same as the Latin guttus arena. Leber's congenital amaurosis is an inherited disease resulting in optic atrophy and secondary severe vision loss or blindness. It was first described by Theodore Lieber in the 19th century. Amaurosis fugax, Latin, fugax meaning fleeting, is a temporary loss of vision in one eye caused by decreased blood flow, ischemia, to the retina. It may also be caused by embolization from atherosclerotic plaques in the ipsilateral, same side, internal carotid artery. It is a type of transient ischemic attack, TIA. Those experiencing amaurosis usually experience complete symptom resolution within a few minutes. In a small minority of those who experience amaurosis, stroke or permanent vision loss results. Diabetes, hypertension, and smoking are factors known to increase the risks of suffering this condition. It also can be the result of surgical repair to the mitral valve, when very small emboli may break away from the site of the repair, while the patient's tissue grows to cover the plastic annuloplasty band. Quinidine toxicity can lead to synchronism and also to quinine amaurosis. This condition can also occur in ruminants suffering from a vitamin B1 thiamine deficiency due to thiamine-related cerebrocortical necrosis (CCN). Those experiencing amaurosis are usually advised to consult a physician immediately, as any form of vision loss, even if temporary, is a symptom that may indicate the presence of a serious ocular or systemic problem.
So, what are the pros and cons? This condition alerts you that your arteries are damaged and you have the possibility to get better. To get to this point, you already had a bad lifestyle, and this is just a sign that your actions have consequences in the future. If you don't care about that, you may have a short life. In many patients presenting with amaurosis fluids, the diagnosis will be established after clinical or ophthalmic examinations. But if the diagnosis has still not been established, further evaluation is needed. UC applied in Ecuador. Patients with amaurosis fluid are at risk for stroke, heart attack, vision loss, and other serious consequences. Ecuador is a country that has a high prevalence of diabetes and high blood pressure, so we are susceptible to have amaurosis fluids. You can prevent this doing exercise and eating better. So, what is the conclusion? Amaurosis is a painless condition that most people don't care about. They think it isn't a big deal because the vision loss is only for a few seconds. But this is a warning sign telling you that your lifestyle must change. You have to get rid of alcohol, cigarettes, fast food, and start doing exercise. Thank you for your attention.